Taping techniques for inhibition and activation. So taping with intention, and I think this is at the fundamentals of this course and how you get the best results using kinesio tape. So as always when you're treating your client, you need to keep in mind, what is your intention? We can only do this when we have provided and done a complete assessment. So looking at all of the subjective and objective assessment criteria, what our clients have told us, coupling that with what we see, what we test and what we find, to hypothesize as to what we believe is going on, and then ultimately creating goals. Short-term treatment goals, long-term treatment goals, and also the goals for the client in terms of lifestyle, movement, or pain level. If, in terms of our treatment planning, the words, the treatments that we keep coming back to are about deloading, resting, recovering, lengthening, decompressing tissue, opening joints, that is where we're looking at inhibition. We are looking to inhibit the muscle when it comes to taping. On the other hand, if the tissue that we're considering for taping is what we associate in terms of our treatment with load, engaging, activation, stimulation, compression through a joint, contraction, firing up muscles or tissues, then we're looking to create activation with our taping. So what's the difference? In terms of what we teach here and what our intention is when we tape our clients, we're looking at inhibition as a means of decompressing the area. So the stimulus that we're trying to create with the tape is about decompressing, opening, creating length. So if we consider the elbow here, where we're looking at that bicep movement through here, what we're looking to do with the tape is create length to open up that joint. So our taping and the direction that we use in our tape will be leveraging that recoil effect of the tape to create a pull on the tissue towards that distal point on the arm, to create that constant stimulus of opening and of lengthening. If we look on the contraction, that concentric contraction, that flexion of the arm, that's where we're looking to use the tape and the recoil within the tape to create a compressive stimulus. So that is a recoil that's pulling that joint into flexion, shortening, creating an activation in the muscle tissue itself. Then the question's out there, which is, does the direction even make a difference? There isn't even any research that proves that the direction does make a difference. But what we absolutely do know is that the tape works in a neurological way, much like what we're doing with our hands and with movement. So even in terms of our intention, our explanation to the client, if that is backing up what we're trying to achieve with the tape, it may even have just a placebo effect in terms of achieving that goal to a greater extent than if we didn't consider the direction in terms of the results we're trying to achieve. So let's deep dive into how we tape for inhibition. First of all, the anchor. Where do we start? So as we said, we want that recoil to be distal, away. So we anchor the tape with no tension on the tape, no stretch on the distal attachment. We don't stretch the tissue, we just rub the tape down and make sure that it sticks well. Now the active piece of tape. So in this case, we want to add a light amount of tension or stretch onto the tape. We ask the client to put the target tissue on stretch, and then we lay down the tape with that light stretch in line with the target tissue, the tissue that we're trying to create the stimulus. Once that's done, we rub it down, make sure it sticks well. We then get the client to relax, and then we create the base with no tension on the tape and no stretch on the tissue, and rub that last inch of the tape down well to make sure that it sticks. Now let's look at a real life example of inhibition to make that become clearer. In this case, we're going to look at inhibiting the pectoralis major, which is a really common taping where we want to open the chest and create softness in an over-dominant or short pec major. My intention here is to inhibit or lengthen that pec major. So I'm going to tape away from the body, so over across the shoulder, humeral head. Now, put a light amount of stretch on the tape and get your client to put the tissue on stretch, so bringing shoulder and arm back here. And then we rub that tape down with the light tension. Relax the arm and apply with no tension on the ends. Next up, let's look at a lower body example. Let's look at inhibiting the quadriceps. So in this case, again, we want to start relaxed. We're going to anchor the tape at the distal end. So we're going to tape it just at that tibial tuberosity below the knee. No tension on the tape, no stretch on the tissue. Now I'm going to peel back the tape of the active piece and I'm going to add a light amount of stretch and ask my client to flex their knee, putting the target tissue on stretch. I rub it down to make sure it sticks well, and I get my client to completely relax the tissue and I apply the base with no tension and no stretch on it at all. Rub the tape down to make sure that it sticks well. Let's turn things on their head and let's look at what we do to activate with our tape. As you can see, the process looks really similar to inhibition. Truly, the only difference here is our intention and therefore the direction. We want to create a stimulation that's compressive, that's active, that is pulling that insertion and origin closer together. So in that case, we are going to anchor at the proximal attachment, so towards the midline of the body. Again, that anchor has no tension on the tape, no stretch on the target tissue. Just lay that first inch down and rub it well to make sure that it sticks. Then we're going to ask our clients to stretch the target tissue. We're going to apply a light stretch or tension to the tape, and then we're going to lay that tape down with the light stretch onto the target tissue, rubbing it well to make sure that it sticks. Finally, we get our clients to relax to make sure that the target tissue is relaxed, and we apply the base to the skin with no tension at all and rub the whole taping down to make sure that it sticks well. So let's see this in practice, and here we're going to look at activating the lower trapezius, which is again a really common taping where we're trying to get our clients to engage that posterior shoulder and help to keep that scapula against the thoracic cage. Activation, so our intention here to shorten, engage that lower trapezius. So we're going to anchor around the T12 point with no tension on the anchor. We're going to peel our tape back, and this time we're going to add some light tension or stretch to the tape and get your client to stretch that scapula away. Rub it down well to adhese it. Relax the client, no tension on the tape as we anchor the end. Our second example here is looking at the hamstring, so a lower body activation. And you will see that the process is the exact same, we're just working on larger muscle groups and bigger joints. Here I'm going to anchor the tape at the hip, so it's lateral hamstrings I'm working on here. So no tension on the tape, no stretch on the tissue. I peel back the tape, I add a light amount of stretch, and I get my client to put the target tissue on stretch, so flexing and rotating away from me. And I lay that tape down, rubbing it well with a light amount of tension. And the base, the last inch or two with no tension and no stretch. So in summary, inhibition, we anchor with no tension on the tape at the distal attachment, no stretch on the tissue. For the active piece of the tape, we add a light amount of stretch or tension onto the tape and lay that down with this target tissue on stretch. So get your client to stretch the target muscle or tissue. We rub that tape down well to make sure it sticks. And finally, the base, we anchor with no tension on the tape and no stretch on the tissue, just rubbing well to make sure that the whole taping sticks. For activation, the process is almost identical. You just need to note here that you're starting proximal, so towards the midline of the body, and finishing distal. Same process, same steps, simply a change in direction.